It was at this encampment in downtown Halifax where police and paramedics responded to a medical distress call Friday. A man taken to hospital and pronounced dead. A volunteer helping those living here devastated.
I believe it was a drug overdose, and from what I've heard, unconfirmed of course, that it was bad drugs.
It's a growing issue. 56 people have died this year in Nova Scotia due to opioids. Not just a city problem, though. Last week, the small community of Spring Hill, Nova Scotia, held a public information session so residents could learn how to administer naloxone after 2 men died in the town of suspected overdoses. Dr. Mike Ginjavik works with vulnerable drug users in Halifax and says tainted drugs are becoming more common.
5 years ago, we hadn't seen fentanyl or anything like this, where in the west of Canada, it was all over. But it's starting to emerge more, and we're starting to see the impacts of it.
You know, I've lost so many people close to me.
Garth Mullins is a methadone user in British Columbia, where the coroner's service says the province has averaged 7 deaths a day for the past 7 weeks and is warning of toxic street drugs.
There's cross-contamination, so even if you're doing cocaine or something, that fentanyl can sneak in there.
The federal government says its Canadian drugs and substances strategy is working and that public health interventions are making a difference, but advocates would like to see much more done.
We are not focusing on the fact that this is a crisis of the drug supply.
That's why experts like COLA have written an open letter to Ottawa calling for the expansion of safe supply programs across the country and longer-term funding for ones already operating.
And the issue is we've never scaled up these interventions to address the scale and the magnitude of the overdose crisis across the country.
A crisis those on the ground say is spreading and only made worse by lack of housing and a struggling healthcare system. Heidi Petracek, Global News, Halifax.